A lot of people want intact hearts these days because they're looking for specific nodes, AB nodes, SA. I was like, wow, I didn't even know. Good for them. Yesterday was the first time she said people wanted lungs. And then, like I said, always as many intact livers as possible. People just want
livers.
Some people want lower extremities too, which that's simple. I mean, that's easy. I don't know what they're doing with it. I guess they want muscle.
Yeah, a dime a dozen.
I'm the medical director for the national office for all of the affiliates.
So I say, okay, what are you looking to supply today? We've been very good at getting heart, lung, liver. Every provider has had patients who want to donate their tissue, and they absolutely want to accommodate them. They just want to do it in a way that is not perceived as this clinic is selling tissue, this clinic is making money off of this.
Okay, so when you are or the affiliate is determining what that is monetary,
Yes.
so that it doesn't raise any question of this is what it's about, this is the thing. What price range would you?
You know, I'm going to throw a number out. I would say it's probably anywhere from $30 to $100, depending on the facility and what's involved.
The $30 to $100 price, that's per specimen that we're talking about, right? Yeah.
Yes.
The $30 to $100 price, that's per specimen that we're talking about, right? Yeah.
Yes.
How much of a difference can that actually make if you know what's expected or what we need versus?
It makes a huge difference. I'd say a lot of people want liver, and for that reason, most providers will do this case under ultrasound guidance, so they'll know where they're putting their forceps. Kind of rate-limiting step of the procedure is calvarium. Calvarium, the head is basically the biggest part. Most of the other stuff can come out intact.
Right.
It's very rare to have a patient that doesn't have enough dilation to evacuate all the other.
To bring the body cavity out intact and all that.
So then you're just kind of cognizant of where you put your grasspers. You try to intentionally go above and below the thorax so that, we've been very good at getting heart, lung, liver, because we know that, so I'm not going to crush that part. I'm going to basically crush below, I'm going to crush above, and then I'm going to see if I get it out intact. And with the calvarium, in general, some people will actually try to change the presentation so that it's not a vertex, because when it's a vertex presentation, you never have enough dilation at the beginning of the case unless you have a real huge amount of dilation to deliver an intact calvarium. So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate an intact calvarium at the end. So I mean, there are certainly steps that can be taken.
So they can convert to breech, for example, at the start of the.
Exactly. Under ultrasound guidance, they can just change the presentation. Under ultrasound guidance, they can just change the presentation.
To bring the body cavity out intact and all that.
So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate an intact calvarium at the end. Federal abortion ban is a law, and laws are up to interpretation. So if I say on day one I do not intend to do this, what ultimately happens doesn't matter.
So yesterday was a clinic day. For example, like what did you procure?
You know, I asked her at the beginning of the day what she wanted. Yesterday she's been at, a lot of people want intact hearts these days because they're looking for specific nodes. AB nodes, SA. I was like, wow, I didn't even know. Good for them. Yesterday was the first time she said people wanted lungs. And then, like I said, always as many intact livers as possible. People just want
livers.
Some people want lower extremities too, which that's simple. I mean, that's easy. I don't know what they're doing with it. I guess they want muscle. But
Yeah, a dime a dozen.
if you maintain enough of the dialogue to the person that's actually doing the procedures and they understand what the end game is, there are little changes they can make in their technique to increase your
Even
success.
though they have a set way that they do it, they're open to changing them.
The reasonable people, sure. For example, so I had 8 cases yesterday, and I knew exactly what we needed, and I kind of looked at the list, and I said, all right, this 17-weeker has 8 grams, and this. So I knew which were the cases that were probably more likely to yield what we needed, and I made my decisions according to that too. So it's worth having a huddle at the beginning of the day, and that's what I do.
Rather than having to deal with all the different affiliates, if there were a way to partner with PPFA directly to get some kind of like pre-clearance or something, so that we have.
So we tried to do this, and at the national office we have a litigation and law department which just really doesn't want us to be the middle people for this issue right now. Because we were approached by STEM Express to do the same thing. One of the Northern California affiliates said, we're working with these people, we love it, we think every affiliate should work with them. And so we had a conversation, and we said, you know, what do you think we'll just go out and find all the people that are doing this and present everybody with a menu, and they, at the end of the day, they just decided right now it's too touchy an issue for us to be an official middleman. But that,
when you say right now, do they see a future?
Right now, the way the Supreme Court looks, I don't think it looks very good.
Okay.
If you talk to my litigation and law folks, anything that's going to go to the Supreme Court right now, we are all losers. But I will tell you that behind closed doors, these conversations are happening with the affiliates.
Cecile, I wanted to thank you so much for Dr. Nuka-Tola. She's been so helpful for the past couple of years. I'm this with fetal tissue collection. She's been very, very helpful with her to talk to and how to like.
Okay, great. Thank you. She's amazing.
And thank you for Parenthood.
Thank you.
Hello, I'm Cecile Richards, President of Planned Parenthood Federation of America. I want to be really clear. The allegation that Planned Parenthood profits in any way from tissue donation is not true.
What would you expect for intact tissue? What sort of compensation? What sort of...
Well, why don't you start by telling me what you're used to paying?
We'll be exhibiting at the Medical Directors Council meeting in a
good.
couple of weeks, so I don't know if you'll be attending.
I'm now the president of that organization.
Oh.
So we had just started the conversation, and Susan was explaining they're a startup, that they have been about a year in business. They're a for-profit company that's connecting researchers with people willing to donate tissue. Our volume, thank you for giving it to me, is 800 a year with 60 in the second trimester. And we just started to talk about how the process worked with Novogenics down in Los Angeles when I was there.
Okay.
To back up a little bit, PPFA, our parent body, is on board with tissue donation, but we have to ask for a waiver to do it, and we have to lay out for them what our program's going to be like. And the mechanics of it was that Heather, Novogenics person, would come to the site, and our staff would sign the patients up and get consent, and then Heather would look at the tissue and take what she required. So it was logistically very easy for us. We didn't have to do anything. So there was compensation for this. We didn't have to do anything. So there was compensation for this, and there was a discussion as I was leaving. They had been paying by the case, and there was some discussion about doing it in a different way, or I don't know what you're used to doing. How are you used to doing compensation? The patients don't get anything, of course. But.
Okay, so I'd like, what would you expect for intact tissue? What sort of compensation? What sort of?
Well, why don't you start by telling me what you're used to paying?
Okay, I don't think so. I would like to know what would make you happy. What would work for you?
Well, you know, in negotiations, the person who throws out the figure first is at a loss, right? So.
No, I don't look at it that way. I know you want to play that game. I get it, but no, I want
lowball because I'm used to low things from.
You know what? If you lowball, I'll act pleasantly surprised, and you'll know it's a lowball.
Okay.
What I want to know is what would work for you. Don't lowball it.
Okay.
Tell me what you really.
$75 a specimen.
Oh, that's way too low. And that's way too low. I want to keep you happy.
I've been at places that did 50 too. But see, we're not in it for the money. Well, why don't you start by telling me what you're used to paying?
Oh, I want
lowball $75 a specimen, and we don't want to be in the position of being accused of selling tissue and stuff like that. On the other hand, there are costs associated with the use of our space and all that kind of stuff. So what would you think about it?
Right. So way higher than that. So I'd like to start at around 100.
Okay. Now this is for tissue that you actually take, not just the tissue that the person volunteered that you can't find anything. Right?
Exactly.
Now this is for tissue that you actually take, not just the tissue that the person volunteered that you can't find anything. Right?
Exactly. Right. What we can use, what is intact. So that's why I'm saying no, don't lowball. I want you to be happy.
It's complicated by the fact that our volume is so low too. I mean, are you looking at 8 and 9 week specimens or only second trimester specimens?
10 to 12 week, end of the first trimester. If those are pretty intact specimens, then that's something we can work with.
So that's an interesting concept. Let me explain to you a little bit of a problem, which may not be a big problem. If our usual technique is suction at 10 to 12 weeks, and we switch to using an iPass or something with less suction in order to increase the odds that will come out as an intact specimen, then we're kind of violating the protocol that says to the patient, we're not doing anything different in our care of you. And to me, that's a kind of a specious little argument, and I wouldn't object to asking Ian, who's our surgeon that does the cases, to use an iPass at that gestational age in order to increase the odds that he was going to get an intact specimen. But I do need to throw it out there as a concern, because the patient is signing something and we're signing something saying we're not changing anything in the way we're managing you just because we agreed to give tissue. I've heard of that before.
Right. Yeah. No. It's definitely.
It's touchy. Okay. How do you feel about that?
Well, I think they're both totally appropriate techniques. There's no additional pain involved. I don't think the patients would care one iota. So I'm not making a fuss about that.
Okay.
Now you have my email address, right?
You got your email, yeah.
Write me a 3 or 4 paragraph proposal, which I will then take to Laurel and others in our organization to see if we want to pursue this. And then if we want to pursue this mutually, I'll mention this to Ian in terms of how he feels about using a less crunchy technique to get more whole specimens. And then if we agree to move forward, the next steps I need to apply to PPFA for a waiver to permit us to do this. We have to have a contract. Do you have a contract already?
We have what we've used in the past is a materials transfer agreement. And that's obviously open to discussion.
So that's a prototype. It needs to say exactly what your staff is going to do, exactly what your expectations are, exactly what your compensation is.
And are we agreed that $100 would keep you happy?
Well, let me agree to find out from other affiliates in California what they're getting. And if they're getting substantially more, then we can discuss it again.
Yes.
But again, the money is not the important thing.
No,
But it has to be big enough that it's
But
worthwhile
but it
giving
is something to talk about. I mean, it's one of the first things that you brought up, right? So,
It has to be big enough that it's worthwhile
but it
giving
is something to talk about. I mean, it's one of the first things that you brought up, right? So,
Now here's another thought: is we can talk about specimen as per specimen per case, or per procured tissue sample, which would be so that if we're able to get a liver thymus pair, maybe that is $75 per specimen, and so that's for for liver thymus pair, and that's $150, versus if we can get liver thymus, brain hemisphere, and all that, then and then so that protects us so that we're not paying for what we can't use. I mean, I think it also maybe illustrates things.
It's been years since I talked about compensation, so let me just figure out what others are getting, and if this is in the ballpark, then that's fine. If it's still low, then we can talk about it. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Yeah, exactly.
I thought I was going to be just drawing blood, not procuring tissue from aborted fetuses. They partner with Planned Parenthood and they get part of the money.
So I say, okay, what are you looking to supply today?
You can imagine where they would run with this, like, you're selling blood,
My name's Holly O'Donnell. I'm 24 and I'm a phlebotomist and an ex-procurement technician. For those who don't know what a phlebotomist is, basically you draw blood for a living. I was looking to help the public. I mean, I'm looking to make blood draws easy for children, for people. I'm very passionate about people. I find myself, I'm very humane and very sensitive. I thought I was going to be just drawing blood, not procuring tissue from aborted fetuses. I basically just went on Craigslist, typed in the word phlebotomist, lab technician, and I clicked the link to apply. It said procurement technician. I went to the website, it said STEM Express, and apply now. I applied. It was really short. It wasn't even an application. It was your name, your phone number. That was it. And I got an email back and I interviewed. And they don't even let you know in the interview what you're doing. STEM Express is a company that hires procurement techs to draw blood and dissect dead fetuses and sell the parts to researchers. They partner with Planned Parenthood and they get part of the money because we pay them to use their facilities and they get paid from it. They do get some kind of benefit. We were asked to procure certain tissues like brain, liver, thymus, pancreas, heart, lungs, and pretty much anything on the fetus. It's basically huge trafficking of fetal tissues.
Right. So I'll just take a couple minutes. Sure. And Brianna is my assistant.
Hi.
So.
Oh, you're warm. I want to hang on to you.
So I was talking to Mary about what I'm trying to offer to clinics as a procurement service, and she said, you know all about this.
Oh, we have already a relationship with ABR.
Oh, okay.
So that's the sort of thing you're doing?
It's a startup. So there's already a service there. I'm thinking with my business head that.
Using them for over 10 years, really a long time. So I just kind of renegotiated the contract. They're doing the I can't remember what they call it, but the big collection for government level collections and things like that. So I'm trying to think of other providers in our town.
So I don't want to sound like a salesman here, but I'm going to. So we return a portion of our fees to the clinics. So just as a way of thank you for this. Just trying to establish.
Right, get a toe in and make it sound, make it clear.
Right.
All right.
They weren't looking for a compassionate individual at all. They were just looking for someone who could get as much money, as many samples. I think that's why they were interested in me as a phlebotomist, because I can draw quick. So I think that they looked at that and they wanted someone who could get the numbers up. The owner, Kate Dyer, she used to be a procurement tech, and then she went and started her own business. And now she's making a lot of money based off the poor girls who half the time don't even want to get abortions. It's a pretty sick company.
Okay, so I'd like, what would you expect for intact tissue? What sort of compensation? What sort of?
Well, why don't you start by telling me what you're used to paying?
Okay, I don't think so. I would like to know what would make you happy. What would work for you?
Well, you know, in negotiations, the person who throws out the figure first is at a loss, right? So.
No, I don't look at it that way. I know you want to play that game. I get it, but no, I want
lowball because I'm used to low things from.
You know what? If you lowball, I'll act pleasantly surprised, and you'll know it's a lowball.
Okay.
What I want to know is what would work for you. Don't lowball it.
Okay.
Tell me what you really.
$75 a specimen.
Whatever we could procure, they would get a certain percentage. The main nurse was always trying to make sure that we got our specimens. No one else really cared, but the main nurse did, because she knew that Planned Parenthood was getting compensated. So she wanted to make sure that everything was going great for us, that it was going great for them, and for us, and it was going great for them.
And are we agreed that $100 would keep you happy?
Well, let me agree to find out from other affiliates in California what they're getting. And if they're getting substantially more, then we can discuss it again.
Yes.
And if this is in the ballpark, then that's fine. If it's still low, then we can talk about it. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Yeah, exactly.
There was one instance where I know that one of the girls was working at the clinic, and she was anti-abortion, but I'm not sure why she was working there. And she knew that I communicated with the staff, like, I need this specimen so I can get this, and there were times where she would always get rid of it before I could. And I would always ask her, I'm like, hey, I just told you I needed that. And she's like, oh, I forgot. And she did it on purpose all the time. And I went to the manager, I'm like, hey, this girl keeps throwing away my specimen. She's like, oh, let me talk to her. And I remember her talking, she's like, we need them here, like, you need to let them have their specimens. But she was pretty adamant about it. She was trying to tell the staff, like, you need to listen to the text, like, you know, Planned Parenthood needs compensation. The harder and the more valuable the tissue, the more money you get. So if you can somehow procure a brain or a heart, you're gonna get more money than just, like, chorionic villi or umbilical cord. That's basically what it is. So that, I guess that's an incentive to try and get the hard stuff, because they get more money. So I remember my first day, I was at the Concord Clinic, and it was very early in the morning. I was with one of my trainers, and I walk in, I meet the staff, and I look over in the corner, and there's a little light tray with pie dishes on it. I'm like, okay. And then I see someone come in with a bottle of something, and there was blood in it. I'm like, okay. And then they went over to the sink, and they emptied it out in a strainer and put it on the pie dish and lit it up, and I'm like looking like, what's going on? And my trainer comes over, and she puts on gloves, and she grabs some tweezers, and she's picking the parts away from the vaginal tissue. And I've never had anxiety before this at all. So I'm looking and I don't know what's going on. I had no idea this was what was going to be happening, especially my first day. And she has tweezers, and she's like, okay, well, this is the head, this is the arm, this is a leg. And then she hands them over. Like, oh, here you go. Can you show me some of the parts I just showed you? And I grabbed the tweezers. I'm like, because I didn't want to lose this job. I didn't know. I was already stoked to get it. So I did what she said. And the moment I took the tweezers, I put them in the dish. I remember grabbing a leg, and I said, this is a leg. And the moment I picked it up, I could just feel like death and pain. Like, I've never felt that before, like shoot up through my body. And I blacked out, basically. They got the smelling salt. I woke up in the recovery room and looking around, I was really embarrassed, who faints to their first job. And when nurses looks at me, it's like, oh, you're new, huh? I'm like, yeah, don't worry, it still happens to a bunch of us. I'm like, really? It's like, yeah, some of us don't ever get over it. And I remember leaving that day, like, what have I got myself into?
So would you call that intact?
These are intact
Yeah,
kidneys,
okay.
yes. If somebody needed...
Because if I looked at that, I'd be like, that's good to go.
Oh, yeah.
That's like 21.
Yeah.
5 stars.
Yeah, you could start a neural cell culture from this neural tissue right here.
Like, would someone want that?
This?
Yeah. Any of
Yeah,
this?
yeah. Oh, yeah. Yeah, someone would definitely.
So even at 11 weeks, even though it's really early, because I know that's when we talked about
This is neural tissue that people could take and look, and you see how it's still connected through the spinal cord back there. If you
we just
pull
send that all
pulls back.
together, and they pick it out. Or
You could actually, yeah. Yeah, some people prefer that actually because it keeps it a little more protected. Yeah. That 11.6 was pretty good. There was there was like 3 or 4 samples we could have taken out of the 11.6, so that would be if we were doing like 50 to 75 per specimen, that would be like 200, 300, right? And we'd be comfortable with that. But like so it's like stuff like this, like we don't want to be like just a flat fee of like 200 and then it's like
No, and I think the per item thing works a little better just because we can see how much we can get out of it.
It's really just about if anyone were ever to ask them, well, what do you do for this $60? How can you justify that? Or are you basically just doing something completely egregious that you should be doing for free? I think for affiliates, the end of the day, they're a nonprofit. They just don't want to. They want to break even, and if they can do a little better than break even and do so in a way that seems reasonable, they're happy to do it. I think this is definitely to be continued.
Definitely.
It's not a fee. It's not a fee. It's actually just the cost of transmitting this material. There are no financial benefits to the
Absolutely
clinic.
not.
Absolutely. And we're happy. Look, we look forward to the facts coming out.
I think the per item thing works a little better just because we can see how much we can get out of it. Because if you have someone in a really anti-state that's going to be doing this for you, they're probably going to get caught. About 20, anywhere between 18 on a light day, but up to 25 patients a day. Obviously not all in the gestational age that you're interested in. But you want mostly over 14s?
Yeah. You can kind of play with that lower range, I think, if the specimens are coming out more intact. And so that, I guess we'll kind of get a first-hand look at that today, later on. How many procedures are scheduled?
Can I interrupt just right there when you're talking about an intact specimen? So how many of those do you see?
An intact specimen?
Within. So what's your volume on an average Tuesday?
With just second tries? Mm-hmm. We're going to be 5, so anywhere as low as 3 up to 7.
Okay. All right, and so intact, can you
Intact,
judge?
so we do basically D&Es. Intact is probably less than 10%.
Less than 10%.
Sometimes, you know, if someone delivers before we are able to see them for procedure, then we are intact.
But you'll
that's
never
not
know.
what we go for.
Yeah.
We try
Yeah.
for that to happen.
Okay.
Sometimes, you know, if someone delivers before we are able to see them for procedure, then we are intact.
So obviously we want product that we can use.
Yep.
That's,
I think that's probably the biggest thing is that we want to avoid paying for material that we're not going to be able to process and use and send to researchers. So if there's, you know, we certainly see a difference between, it makes a big difference to us if there's a case that is, you know, so mangled we can't even get like a shred of, you know, piece of liver out of it versus something that we can get, you know, we can get liver, thymus, pancreas, and neural tissue.
So
obviously that second case is a lot more. Sorry, no, I didn't mean
so
to.
compensation could be specific to the specimen.
Okay. And I think then we would just, I mean, I think for us, we would need criteria.
Yeah, clear criteria.
For what makes something
usable or not.
Okay.
Right.
And even if you have pictures, because I think some of it is visual, at least at this level.
Right.
Because we're not able to, we're not looking at things under the microscope to be able to see whether it's visible or not.
Right.
So this is going to be naked eye determination, and so those kinds of things of what you're looking for. Obviously, you'd get trained. I don't know if I've ever seen a thymus, but maybe I haven't. I don't know that. I know I've seen livers, I've seen stomachs, I've seen plenty of neural tissue. We usually, you can see the whole brain usually come out. You know, when you get to 17, 18 weeks, because we do some of those, and that's when you're doing a lot more of the D&E, and you might get larger. So that's where we have to do a little bit of training with the providers on making sure they didn't crush or were able to.
So it's a matter of just training, it sounds like, to a provider.
I think so. I mean, it's hard to know how their specimens come out right now because it's not like we've ever been looking.
Right. It's not your. Yeah.
We haven't been so it's we have to kind of see the baseline of how things are getting extracted now, and then see if we could do any work with them to maybe be a little bit more gentle. So I feel like if you're talking to other Planned Parenthoods, we sort of all have to be on the same page, almost to the point where we have to disclose to each other that we're all doing this. So if anyone gets called out or runs with it, that we're all like, oh, I didn't know you were doing this. Oh, I'm doing this too. Oh, you know, we have to be. I think we have to be coordinated with each other.
To keep the story straight.
Well, and to make sure that we're all saying the same thing, and that the CEOs are all saying the same thing.
I think the resistance that I have felt is from people that, yes, they want to do it, but they don't understand that doing it right can be easy, just with getting the attorneys on board, having, I mean, we all know that, for example, compensation. I want to come in and pay you top dollar because I know what you're going to be facing, and I want you to be happy. I want to make sure our suppliers are happy. So compensation, okay, your cost is negligent. So it could look like we're paying you for specimens. So let's talk about it correctly. We all know that, yes, that's what we're doing.
Processing and time. And
exactly. So yes, I am paying you, but how we're talking about it out there in the public square.
Are the other Planned Parenthoods doing this through research, or are they just doing it as a standalone contract? Because even though we're doing it through research, if it comes up that someone else is just doing it as a business sort of venture, it's a different spin on it.
So how could you imagine that being handled if that is?
We'd have to, that's where, I mean, I'd have to talk to Deb and see who else was involved and get us all together. I think Deb could probably spearhead something, so to sort of be on the tail end of your conversations where you actually have contracts in place.
Are we talking about Deb Nucatola or Deb Vanderhei? Nucatola. Because so I feel like she has said before that they decided at national that research was overkill for tissue procurement because it's not really research, it's just collecting tissue, so there's no
But
study.
putting it under the research gives us a little bit of a little overhang sort of over the whole thing.
It makes it look better.
Yeah, I mean publicly I think it makes a lot more sense for it to be in the research vein than as a
right. It's how we talk
venture.
about it. Yeah, it's
how
how
we
we
talk
talk about it.
So even though they don't want to do it, and I may need to call research and Deb and just kind of shake this out because I do want the other Planned Parenthood, I want us all to be making the same decision. So if we all decide that we're going to do it outside of research, then we do it outside of research. But if we all decide we're going to do it under research, that we have a different path, that we know that we're all registering and doing the same thing. Again, it's just that cohesive bond, I think.
So you really think there should almost be a national policy and protocol for how Planned Parenthood affiliates do tissue
You
procurement?
can't, just because we're all so different.
Oh.
But we have to know who else is doing this. Because if you have someone in a really anti-state that's going to be doing this for you, they're probably going to get caught.
How confident are you with your attorneys, the work that you've seen? They're building many layers so that they are making it difficult.
He's got it figured out that he knows that even if, because we talked to him in the beginning, we were like, we don't want to get called on, selling beetle parts across.
Neither do we.
You know what I mean? Like no one wants to get
right. So how do we protect
ourselves from that?
And you feel confident that they're building those layers, and
I'm confident that our legal will make sure that we are not put in that situation.
Was that crack? Was that just the little bits of the skull?
Sometimes I just want to see one leg.
That's the heart.
I think so, right?
Yeah.
Here's the heart.
Everyone's
I
trying
think
to get in on it.
my fingers will smush it if I try to.
You're trying to pick it up.
The heart is
You
right
found
there.
heart over there.
So would you call that intact?
These are intact kidneys,
Okay.
yes. If somebody needed...
Because if I looked at that, I'd be like, that's good to go.
Oh, yeah.
That's like 21.
Yeah.
5 stars.
There was like 3 or 4 samples we could have taken out of the 11.6, so that would be, if we were doing like, 50 to 75 per specimen, that would be like 200, 300, right? And we'd be comfortable with that. But like, so it's like stuff like this, like we don't want to do like just a flat fee of like 200 and then, it's like...
No, and I think the per item thing works a little better just because we can see how much we can get out of it. So what do they want brain? What do they do with
Yeah,
it?
no, so brain, what you can do is with brain they...
Do people do stuff with eyeballs?
Oh yeah. Although eyeballs, they generally want more developed than this. And the cow, first there was brain in here.
Blasted out?
They got blasted out with the water.
Well, a lot of times, especially with the second tries, is we won't even put water because it's so big. You can just put your hand in there and pick out the
Right, and
parts.
just pick it up.
So I don't think they would be as war-torn.
Yeah, war torn. Oh dear.
Oh, here's some organs for you. They're all attached. Here's the
Really?
stomach. Oops, sorry, they both of you. Kidney. Heart. I think it's the stomach. The heart, kidney, and adrenal. I don't know what else is in there. Tiny.
Arms. I don't see the legs. Did you see any legs?
I didn't really look, but.
Oh, there's some. Oh,
There you
they
go.
are.
Yep. You got all of them right
And
there.
another boy. Another boy. Boy.
Planned Parenthood makes zero profit on any fetal tissue donations.
You are reimbursed for what costs?
Simply costs of preservation, transfer,
If we alter our process and we are able to obtain intact fetal cadavers, it's all just a matter of line items.
That would be $100 per specimen. 50 specimens per day would be $5,000 per day that Planned Parenthood was collecting from fetal tissue. Extrapolate that, $120,000 per month. That is certainly not recouping cost.
In terms of areas that I can contribute to the organization, both locally and nationally, is diversification of revenue stream. Well, so under the scope of where we probably have an edge over other organizations, our organization has been doing research for many, many, many years. And we've had studies in which the company, or in the case of the investigator, has a specific need for a certain portion of the products of conception, and we bake that into our contract and our protocol that we follow this. So we deviate from our standard in order to do that. Telling you this so then we can get creative about when and where and under what conditions can we interject something that is specific to the tissue procurement needs. Yeah.
Sorry, that goes to my perfect for my next. Can you get creative? Can you alter if we say we need a liver?
No, or not just liver, thymus, but let's say neural tissue is
neural
very
tissue
difficult because.
Could you adjust the procedure if you knew? Okay, they need high volume of this. Could you match that and?
18 to 22 week neural specimens, in
so
both hemispheres intact.
Yes. You could do that.
Yeah, okay. I think we can. I mean, some of it is really outside. Some of it will be happenstance because sometimes as the procedure is happening, the procedure itself for the removal is generally standardized, and I'm saying generally loosely, generally standardized. And so just depending on the patient's anatomy, how many weeks, other where it's placed in the uterus, we're going to potentially be able to have some that will be more or less intact, and then some that will not be.
Right.
So, but it's something that we can look at exploring how we can make that happen, so we have a higher chance. It'll probably also require a little bit of input from the doctors, because the doctors are the ones asking, directly doing that, and when it matters, in the cases of when it's mattered, and the physicians also need an intact specimen, they can make it happen. So we just need to figure out how that we can do this, under our project needs.
How many providers practice in the second trimester for you guys?
That's a good question. I know everybody that is here does.
And really, specifically the later than 16-week cases, I guess.
I want to say that we have 6.
6 providers that go beyond 16 weeks. Oh wow.
And that's something we'll have to discuss, with the docs and see how they can do it. Because some of our doctors in the past have projects, and they're collecting the specimens, so they do it in a way that they get the best specimens. So I know it can happen.
The doctors were also doing research. Oh wow.
Yeah. So
very good. I'm more on the business end of it. I know that just going with the history of what's happened and wanting to not have that happen again. So for specific specimens, the compensation would be higher because we know you're going to run into problems.
There's going to be more.
How do we frame that so that we're not saying we're giving a higher...
Yeah, we can work it out in the context of obviously the procedure itself is more complicated, so that anything that we integrate into that procedure without having you cover the procedural cost is going to be higher, So anything about higher gestational age, there's more opportunity for complication, there's more administrative time involved. Sometimes the procedures are longer. So then anything that we piggyback onto that for collection purposes, obviously, would have to reflect that additional time, cost,
Right.
administrative burden.
So that our compensation that's hired to you for our specific specimen intact could be built
And
into
that's something that getting more information about it, as intact as you need, how we're going to do that. Then from there, when I'm working with our clinical trials and all of our additional specimen collection needs, I'm pretty bullish about getting as much information as I can prior to budgeting.
Well, that your financial background, really, I think that's what you can see the benefit of this financially. Just having that background and seeing that there is it's gold out there. There is, and it can be so beneficial. So I'm glad that you have that background, so that you see the financial benefits of getting the right specimen and getting it intact, and if you have to change the procedure just a little bit within the framework that keeps it, we're all talking about it the same way and the right way, but that financial gain and the to your staff just knowing this is the end.
I think everyone realizes, especially because my department contributes so much to the bottom line of our organization here, even though we're one of the largest affiliates. Our research department is the largest in the United States, larger than any of the other affiliates combined.
Wow.
If that provider is needing to change the technique a little bit, and I know I'm going against my side of this, but I'm okay with, no, I want you to be paid per specimen, and rather than, oh, here, just ship this off. No, this is what we're looking for, and if you can do that and it compensates you and financially that's helping you to grow your clinic, I'm willing to do that.
And so if we alter our process and we are able to obtain intact fetal cadavers, then we can make it part of the budget that any dissections are this, and splitting the specimens into different shipments is this. I mean, it's all just a matter of line items.
And so what are they? Are they requesting just liver or liver thymus? Liver thymus long bone?
Everything. CNS, brain, kidney, thymus, liver, spleen, femur, bone marrow, hematopoietic stem cells from 14 to 22 weeks of gestation.
They're going to engraft all of those or just the hematopoietic? Purpose and objectives.
And they want it up to 22 weeks?
Yeah, including CNS, brain. Wow, they want everything. See, so that's the thing. So for a study like that, if we could provide, just a whole cadaver, and then they can take exactly what they want with the full quality, and everything, that is actually going to be ideal for them.
Well, it would make me very happy for us to finish up what we need to do, and I can put you in contact with them.
And their range ranges 14 to 22 weeks is what they're saying.
Yes.
Okay.
Oh, and I was wrong. They want 120.
120. This is huge. Are there any fresh specimens from today that we can still look at, or?
We had a really long day and they're all mixed up together in a bag. Yet if I would have known 10 minutes ago, I would have saved something.
You know what, though, if we could that doesn't, I mean, it's not like we need something today, but if we could get a visual today of it, that would be a good thing. Is that possible?
Yeah, let me see. That one's probably frozen.
What we're looking for is like a visual baseline of like intactness and everything, and just so that we know like
intact they are.
Right.
Yes.
So like on a typical day, like kind of what that looks like, and then
And it
what sort
varies
of.
like based on gestation. Sometimes they come out really intact. Do you want to do?
You're not gonna see nothing intact
Because the way we collect the tissue, it all gets collected into one container.
You know what? Is it cremation?
What was the latest case that you did today?
The latest case we did today was a 5 week and 3 days.
No.
20. It was a 20. Oh, I know what you mean.
Right.
20 station age. And that was one of the very first ones. So I'm assuming that one could almost be frozen.
So we're oftentimes looking for liver and thymus are two of the most in demand.
Yes.
Excellent.
All right.
See now this. Sean, can you help me out? I think this is lung, right? I don't think this is kidney. Yeah, these are lungs because that's the trachea in the middle there.
These are. So the intestines right here. Right here. See?
Yeah.
This comes out, like I said, the organs come out really, really well.
Right.
All the intestines.
Right.
Pretty much almost like
this is a big placenta right here.
Yes.
Do you ever see thymus?
This case is really important. Whenever we do like the 20, 22 weekers we do, you get a lot better.
But it's difficult to find thymus at this gestation.
Yeah. What is the age of this? This patient was like 18 weeks, I think.
Is this? This is limb. Okay,
yeah.
And this is like scapula.
Yeah. The other thing that plays a tremendous part in this all is the dilation.
Exactly.
That you've obtained.
Exactly.
And also how cooperative the patient is during the procedure.
Oh, really? Are they under conscious sedation? Or
Yeah.
Okay.
There's conscious sedation, but there's also times where it's just not. You've pretty much maxed out, and there's tolerance. So sometimes it's a little bit more difficult. To completely relax. Sometimes it's a lot easier to not do so many passes in the forceps. So it just really varies. And like I said, a lot of it does depend on the dilation that was obtained. And like all of our procedures over 20 weeks actually go through a 2-stage dilation process. So usually like the cervix is, like for this procedure, cervix easily like at 3 centimeters. What we do in the OR is that we lay them out to account for everything before it kind of gets put back in the basin and just like sealed up and packaged up. Because we actually do a lot of collections for sexual assault cases. Kind of, but with that it's different. It's like some placenta and a long bone. But it's still very, it's very cleaned up. So it's different than this as well. So.
These orbits are good too, and at this stage you start to get the retinal pigment epithelium, which is in the back, which is you've collected that before.
So all the orbits are so easy, like 95% of the
They're easy to find too, even in the early gestation, because you're just looking for the.
They come out like firmer a month type deal, because it whittles down some. Is that a viable number for you?
How many per month? Or the gestational age, 14 to 16, or?
No, 40. From like 16 to 22.
There's how many per? Yeah.
40 to 50 easy.
Per month.
Yeah. Although Gamma Planning Fellowship in Columbia, the active researcher, so she's very well versed in what she needs to do.
To just change up just a little bit. Okay.
They've already talked with PPFA, done Necatola and the whole group up there, and because fetal tissue donation varies so much state by state, PPFA is moving away from a standardized policy.
Yeah, so because I attended the patient service day, and Kristen Flood did talk about fetal collection and stuff like that, so
Very interesting. Remember when I first got here, and it was, you have to have this form, it has to be like this.
We had to have this particular consent form, very specific, but that's what Kristen was saying. Because they're encouraging more participation, but they don't want to get too, does that make sense?
Interesting. Okay, cool. And any idea why the other affiliates in Texas think it's illegal?
Really?
You want to see some more?
She told me, it's like, it's not an option. Like, it's a demand. that's what your job is. There are times where they would just take what they want. And these mothers don't know. And there's no way they would know. When you first go to the clinic, what you do in STEM Express is you go to the head nurse and you tell them if there's something you need. So let's say that day I needed a certain gestated fetus. So let's say I need a 15-week fetus for some reason. So I go, I'm like, hey, I'm looking for a 15-week fetus today. If could you let your staff know? I was like, oh yeah, we'll let you know. Each procurement tech usually has an assigned clinic that you want to build a relationship with at your Planned Parenthood, because you have to have really good communication. So Megan was at B Street with Sarah. Jessica had San Jose de Alameda. I had Stockton and Fresno. Fresno was in actually an alley. Areas like Fresno where it's dirt cheap and the area is not good. There were so many. I would work for 8 hours and there would be 40-something patients. It really wore me down. It's the environment. It's morbid. Like, you can feel it. You can hear screaming. You can hear crying. Like, so they give you a sheet and it's everybody for that day who's coming in for an ultrasound, who's coming in for an abortion, medical or late-term abortion, and we basically walk around the clinic and make sure that we have time, we consent them, we take them in the room or meet them in the chair. Some women they come in, they do a test, and then you find out they're pregnant. Then you can consent them. So pregnancy tests are potential pregnancies, therefore potential specimens. So it's just taking advantage of the opportunities. The fetus, the fetal tissues remains is a POC, which stands for product of conception. The specimen is what I would obtain from it. So POC, product of conception, specimen is what I would procure. I would set up my laptop, then you would log into the task page, log into AIM Instant Messenger. You would go get the gestation sheet from the head nurse, and you would see how many opportunities you had on the sheet. So then you would report that. The task page would just list the tissue, where it's to be sent, and then the number of specimens and equal. And so we all had access to edit that page. So if there was, it said we needed a liver, 17 weeks, John Hopkins or Stanford, Berkeley, whatever it was. And it said specimen, so if I got that, I would put my initials, so I'd edit it, put 1 HO. So that way, if we needed one, that's already cleared for that day. So everybody would log in and you would say, oh, there are 24 appointments today, 10 tissue opportunities, 8 blood sample opportunities, first patient at 8. So then I would wait for certain girls to come in. I would look for an opportunity to consent. So that would mean, like, after they go in, they get registered as a nurse, go sit down. That would be a great opportunity for me to, hey, can I talk to you for a second? Come in, shut the door. STEM Express had a consent form we'd have to initial. I'm certified, I'm donating, I know I'm not going to be reimbursed or compensated. I know this is for disease research. I've already consented that I am going to get an abortion. Yeah, no. That doesn't happen all the time. Some of these women don't know if they're going to get an abortion. Some they're not 100% they're going to get it done. Didn't know a lot about Dr. Berman, other than he worked for Planned Parenthood. There were actually comments made about him. He had a reputation for going viciously fast. Like, if we didn't watch him, we would lose our specimens. It was that fast. If there wasn't a girl in the room, he would get mad. He would pace the hallways if there wasn't something to do. Like, it's almost like he wanted to do it. And that made me really concerned. And how fast he was going with these women. And I felt bad. Like, there was a few times to where he was working and I had a girl who did not want to get it, but she felt she had to. I wanted to tell her, do not go to this clinic. When I imagine, because I've seen abortions, I imagine him literally going into the room, lifting the covers, going in, grabbing, and walking out. Like, that's how fast it is. It's ridiculous. I was the only person who is a licensed CPT-1, a licensed phlebotomy technician, but the other individuals were drawing blood in the clinics. The coworkers I had, they would not consent the donors. If there was a higher gestation and the technicians needed it, there are times where they would just take what they wanted. And these mothers don't know. And there's no way they would know. There were times where, I remember one time it was the Fresno clinic, and that was the most high volume clinic we have, lots of abortions, lots. And I had a very gestated woman that was a LAMS patient. So LAMS patients, it's a 2-day process. So they take a certain material, they come in, they insert it into the uterus to expand it, and then you come the next day, they take it out so they can extract the fetus. So I consented her, and she said no, and I'm fine with that. I'm not going to press anybody. I'm not going to consent a girl who's throwing up from the abortion medication. That's not who I am. And she said no, and the next day, Jessica came, and she's like, oh, that high gestated girl, you have to get her, make sure you get her. I'm like, oh, I already consented her yesterday, she's not comfortable. And she looked at me like, okay, walked out, took her into the room, and she came back out and she was holding all these tubes. And all I said to her was, what did you say to her to get that blood? She's like, nothing. I'm like, so basically you just went in there and took her blood, and you're going to be taking her fetus without her knowing. So yeah, I'm not, it's terrifying. Like, imagine if you were an abortion patient and someone was going in and stealing your baby's parts. And half of these women are already on the edge as it is, so it's terrible. The women I worked for were cold. It's cold. They don't care. They just wanted their money. They didn't care that the girl was throwing up in the trash can, crying. And even there are times to when patients would ask me, like, they would come in and be crying, like, should I do this? Should I be doing this? And from my personal view, I'm very pro-life, and I would tell them, like, run, like, go, like, you'll figure something out. You don't want to do this. Like, if you don't want to do this, go home. And I would get in trouble for that. I'd get in trouble. Jessica would say, why don't you consent her? Like, because she was crying and throwing up, and she didn't even know if she wants to get it done. What'd you say to her? I told her if she wasn't comfortable with it, then I'm not gonna do anything. She said, well, that was an opportunity you just missed. Like, I'm not gonna tell a girl to kill her baby so I can get money. And that's what this company does. Straight up, that's what this company does. My job was to go there and get blood and tissue parts. Like, it wasn't presented as an option, really. From my boss, the words of Sarah, it's not. Like, she told me, she's like, it's not an option. Like, it's a demand. That's what your job is. I said, I'm not gonna push them over the edge when they're already on the edge. Like, there's a reason why they keep journals in the recovery room. Like, if abortion was a good thing, there wouldn't be so much emotional damage from it. End of story. I would take my sample, I'd put it in a tube, I would label it with a specimen sticker, I would take it back to the room, update the task page, put 1 or 2, how many I got that day, and I'd fill out the paperwork on my computer, print it out at the lab, and that's what I would do all day. And then at the end of the day, I would put everything in a FedEx package, and I would have to drive to a FedEx and drop off the specimen. And the sad thing is, people would ask what was in the box, and I didn't know what to say. Like, oh, there's dead baby parts in there.
For example, so I had 8 cases yesterday, and I knew exactly what we needed, and I kind of looked at the list, and I said, all right, this 17-weeker has 8 grams, and this. So I knew which were the cases that were probably more likely to yield what we needed, and I made my decisions according to that too. So it's worth having a huddle at the beginning of the day, and that's what I do.
I never did, but I think I've witnessed some of the other technicians work with the doctors. I remember I was on my day off and I went on my laptop and popped up and they were working, and I saw a message saying that the doctor had aborted a fully intact fetus. Fully intact, and SemExpress was sending it straight to the lab.
I literally have had women come in and they'll go in the OR and they're back out in 3 minutes. And I'm going, what's going on? Oh yeah, the fetus was already in the vaginal canal whenever we put her on syrups. It just fell out.
Yeah, and so if we alter our process and we are able to obtain intact fetal cadavers, then we can make it part of the budget that any dissections are this, and splitting the specimens into different shipments is this. I mean, it's all just a matter of line items.
Usually they want both hemispheres intact with the brainstem, which usually doesn't happen. They'll take like an 80% intact or 70% intact, then you have to contact them and see if that would be okay.
Got a rate-limiting step of the procedure is calvarium. Calvarium, the head is basically the biggest part. Most of the other stuff can come out intact.
Right.
It's very rare to have a patient that doesn't have enough dilation to evacuate all the other
To bring the body cavity out intact and all that.
And with the calvarium, in general, some people will actually try to change the presentation so that it's not vertex. Because when it's a vertex presentation, you never have enough dilation at the beginning of the case unless you have a real huge amount of dilation to deliver an intact calvarium. So if you do it starting from the breech presentation, there's dilation that happens as the case goes out, and often the last you can evacuate an intact calvarium at the end. So I mean, there are certainly steps that can be taken.
So they can convert to breech, for example, at the start of the.
Exactly. Under ultrasound guidance, they can just change the presentation.
Okay.
I was training with Jessica in the Alameda, and I've been doing it for a few weeks, so I kind of knew what I was doing, but kind of not. And it was really busy, and one of the doctors came in and she looked really frustrated. The medical assistants were with her, and I don't know, it was my deal to listen and see what's going on, and the doctor just says if she can't calm down, I can't do the abortion. Like, and I can't medicate her. Something like that, and she was just distraught.
The other thing that plays a tremendous part in this all is the dilation that you've obtained, and also how cooperative the patient is during the procedure.
Finally, the woman, she calmed down, and the doctor went in to perform the abortion. Takes a little while, and I'm in the hallway. I see the jar come out, goes into the path lab, and Jessica, I can hear her, is preparing it, rinsing out the jar, rinsing out the linen, the wrapping that catches it, dumping it in the strainer, rinsing it off, putting water in the pie dish, and getting it ready for the doctor. So then I hear her call my name, hey Ollie, come over here, I want you to see something kind of cool, this is kind of neat. So I'm over here, and this is the moment I see it, I'm just flabbergasted. This is the most gestated fetus and closest thing to a baby I've seen. And she's like, okay, I want to show you something. So she has one of her instruments and she just taps the heart and it starts beating. And I'm sitting here and I'm looking at this fetus and its heart is beating. And I don't know what to think.
Is there still circulation in the heart once you isolate it?
So, there are times when after the procedure is done that the heart actually is still beating.
They induce fetal demise at about 20 weeks, 18 to 20 weeks, and so they inject digoxin into the fetus.
Right. I was actually going to ask you about it because I want to make sure there's no digoxin on my sample.
No.
Providers who use digoxin use it for one of two reasons. There is a group of people who just use it so that they have no risk of violating the federal abortion ban. If you induce a demise before you do the procedure, nobody's going to say you did a live, whatever the federal government calls it, a partial birth abortion.
Whenever you're talking about fully intact fetuses in the context of fetal tissue procurement, those are situations where no feticide, like digoxin or potassium chloride, no chemical like that can be used to kill the fetus beforehand because that poisons the organs and the tissues.
Yeah.
And so in that case, it's prima facie evidence of born alive infant cases.
And it's like, you know why that's happening? And I knew why it was happening. It's because the electrical current was, the nodes were still firing. And I don't know if that constitutes it's technically dead or it's alive. It had a face. It wasn't completely torn up, and its nose was very pronounced. It had eyelids, and its mouth was pronounced. And then, since the fetus was so intact, she said, "Okay, well, this is a really good fetus, and it looks like we can procure a lot from it. We're gonna procure brain." So, the moment I hear something like that means we're gonna have to cut the head open. So it's like, okay, so what you do is you go through the face. I'm thinking, no, I don't want to do this. And she takes the scissors and she makes a small incision right here and goes, I would say, to maybe a little bit through the mouth. And she's like, okay, can you go the rest of the way? And I'm like, yes. And I didn't want to do this. And so she gave me the scissors and told me that I have to cut down the middle of the face. And I can't even describe what that feels like. And I remember picking it up and finishing going through the rest of the face. And Jessica picking up the brain and putting it in the container with the media and parafilming it. And she left and she's like, okay, you can clean it up. And I'm just sitting there like, what did I just do? And that was the moment I knew I couldn't work for the company anymore. And that was still, it was, even if it's going to be good, if that could have been the cure for some kind of disease, then I wish, even if it was, I wish I still wouldn't have done it. I don't want to be that person. And I remember picking, it was a male, I remember picking him up with the gloves because it was too heavy. The pie dish was this, and he was big, the pie dish, and I couldn't take it and put it in the strainer and put it in. I couldn't. It was just too big. And I opened the biohazard container, and it's almost full. It's almost full. I'm holding him in my hands. I'm like, oh my god, this is just, what am I doing? And I take him, and I put him in, and I remember he got stuck on the lid, and it turned around, and his buttocks was in the air, and his 2 feet were dangling out, and I remember having to pick each one of his feet up and put him in the container and close the lid. And that was the hardest experience I've had there. I remember holding that fetus in my hands when everybody else was busy and started crying and opened the lid and put it back. It's just really hard knowing that you're the only person who's ever gonna hold that baby. It's weird because I always think of all these scenarios that could happen. I held it, I'm like, man, this could have grown up to be. And I always think about things like that. If this could be a lawyer, this could be a firefighter, this could be the next president. I wonder what, because you can tell the sex sometimes. I wonder if this, what it would like. I can imagine, I wonder at age 3 if you know, she would like to color. Or things like that, you know, I wonder what it would look like, her mom or her dad, or things like that. I feel like it's a waste of life. Like, and it's sad that so many people view it as a mistake. You know, because it's not. I mean, life isn't a mistake. I mean, getting pregnant it can be an accident, but it's not a mistake.
Planned Parenthood has volume.
Right.
You know, because they're a volume institution.
Right.
Oh yeah, I mean, if you had intact cases, which we've done a lot, so we've sometimes shipped those back to our lab in its entirety.
What I saw, I had one incident where I had a person that I promised something to, and I couldn't deliver. And I thought, I told Robert, we need to find, places that are able to
produce the volume you need.
Yes.
Yeah.
So that we're not looking. Oh yes, we can get you this.
Yeah.
So anyway, that's. And then when we were able to get contracting with people that I feel 95, 99% sure that we're going to be able to fulfill our side to researchers. And
so many of them think they can, right? So many of them think they have the volume, and it's like not really. And
right.
So many physicians are like, oh, I can totally procure tissue, and they can't. So it's just it's a lot of misinformation. You deal with that quite a bit. Yeah. Well, I think I was looking on the website a little bit earlier today and just sort of seeing all the different things that you have listed there. I think on the topic, on the fetal tissue side of it, you know, it'd be helpful for us to understand volume-wise. I mean, realistically, if we were to do an agreement with you guys, you know, what do we think you could get? I mean, what do you feel like you could get?
Volume-wise?
Yeah,
okay.
On specifically liver tissue, because that's such an area of demand for us.
Right, so liver and what about intact specimens?
Oh yeah, I mean, if you had intact cases, which we've done a lot, so we've sometimes shipped those back to our lab in its entirety. Oh yeah, I mean, if you had intact cases, which we've done a lot, so we've sometimes shipped those back to our lab in its entirety. Okay. So that would also be great if you have
the entire case.
Yeah, because it's just, again, the procurement for us, I mean, it could go really sideways depending on the facility.
Yeah.
And then our samples are destroyed, and we're like, really, this was all so much work, and then just to have them be destroyed is awful. I mean, we have, you know, researchers wait forever, and they want certain things perfectly done. So, you know, we started bringing them back even to try to manage it from, you know, procurement expert standpoint.
What goes wrong? Tell me what goes wrong that you think you're getting something and it doesn't come through.
I think for us, you know, for the liver tissue, focusing to that piece at least, we've seen like doctors provide blood clots. You know, oh yeah, we've got a liver. You know, they think it's a liver and it's a blood clot. So you know, we've seen plenty of those. We can always tell right away because it's just red water by the time it gets to us. You know, so it's like, wow, it disappeared out of the conical container. Yeah, and there's just so much too. Contamination-wise is another big issue. I mean, so. You know, we've seen all sorts of things, but yeast contamination, you know, that can be an issue. You know, we have a number of quality checks we have to go through with things internally, you know, just to make sure that we're not, you know, investing a bunch of money into trying to isolate cells just to find out that they're contaminated. So it's just, you know, there's a lot of steps there too that the researchers ask us to do. So, yeah. And then we'll do testing on our side, so we'll be able to see, you know, and sometimes we find that it can be clinic specific. I've seen really rampant problems with bacteria in certain clinics. Some where you're kind of like in question of really should they, you know, I've seen staff come out of clinics, so I mean, I've seen all sorts of things come out of clinics. So
just the different sites that we visited.
Yeah, I mean, exactly, right? So it's how serious the clinics sort of, in their own facility kind of looking at that too. So, but so then, I mean, on the range piece, and I mean, what do you guys feel like you could do on that front? Maybe.
So what would keep your lab happy? Like, what would make your lab happy?
Another 50 livers a week.
So what would keep your lab happy?
Another 50 livers a week.
Yeah. Okay, so you can handle that.
Yeah.
Okay.
Yeah, I mean, it's volume for us, and just so you guys know too, on the collection side for us, we're also, as you see Megan out there at clinics, right? I mean, we're working with, almost like triple-digit number of clinics. So it's a lot on volume, and we still need more from what we do. So it's a lot.
Okay.
Yeah.
So
I don't think you're going to hit a capacity with us anytime in the next 10 years.
Well, I mean, going into it knowing it has to be financially beneficial for you.
Yeah, and both of us,
right,
for sure.
Right, and so promising the providers, making it financially beneficial for the clinics.
Yeah.
Everybody has to be doing their job, and that's what I'm trying to find out is who needs to be doing what, who hasn't been doing what, why has it been a failure financially for clinics or you or us, and solving those problems so that everybody's profiting financially.
I feel like there's clinics out there that have been burnt that feel like they're doing all this work for research and it hasn't been profitable for them.
Really?
No, do you feel that way? Sorry, that was.
I thought you were saying that.
Yeah, no. Okay, good. I was going to say, I don't see that either. I feel like there's clinics out there that have been burnt that feel like it hasn't been profitable for them. I was going to say, I don't see that either. I haven't seen that piece either with that. As you probably know, potentially, I mean, I think that one of the issues with neural tissue is so fragile. It's insanely fragile.
Right.
And, I don't even know.
Whenever you're ready, no rush.
Thank you. Thank you. Thank you, guys. That's very sweet. I was going to say is that I know we get requests for it's the hardest thing in the world to ship.
You do is the whole Calvarium.
That's it. Yeah, that's the easiest way. And I mean, we've actually had good success with that in the past. So
make sure the eyes are closed.
Tell the lab it's coming. Did I open the box? Oh God. You know what I mean? So where so many of the academic labs cannot fly like that. They're just not capable.
Why is that? I don't understand that.
It's almost like they don't want to know where it comes from. Megan's seen that, where they're like, we need limbs, but no hands and feet need to be attached. And you're like,
they just want the long bones and they don't want to see that
they want you to take it all off, like make it so that we don't know what it is.
Yeah.
It's like
bone the chicken for me, and then
that's it.
then I'll eat it.
But we know what it is. I mean, but their lab.
So this goes to that whole stigma.
Oh yeah. And their lab techs freak out and have meltdowns, and so it's just kind of like, And I think, quite frankly, that's why a lot of researchers, ultimately, some of them get into a lot of other things, right? They want to look at bone marrow, they want to look at adipose, they want to look at, adult human kind of adult-based sampling, because they sort of want to get away from having to publish a paper that says we derived this from fetal tissue.
Okay.
Do you feel the same kind of support like from Cecile and from Deborah? And
and just everyone at PPFA and just the affiliates. I mean, I just think you're either in the cause or you're not.
Yeah.
And if you're not in the cause, like they don't need you around.
Get out.
They need champions, and if you're not a champion, you should go.
Yeah.
Because that's just and I don't know, the clinics, they're very guarded, as they should be.
Yeah.
And who do they let in their house? They want champions in their house, right? So it's just, I think it's that same concept, and ABR's just never truly understood that.
Yeah.
And I think it's been sort of the downside to that.
Yeah. Are you seeing any trends between the independents versus Planned Parenthoods, or your percentage right now breakdown? Are you doing, is it pretty split evenly, 50-50?
It probably is. I don't know. It is different, but I don't know that I could think really one has more pros or cons than the other. I mean, Planned Parenthood has volume,
right?
Because they're a volume institution. Planned Parenthood has volume,
right?
Because they're a volume institution,
right?
Oh, we have already a relationship with ABR.
Business had that.
Using them for over 10 years, really a long time. Whenever we have a smooth portion of liver, we think that's good.
There are no financial benefits to the
Absolutely
clinic.
not.
Absolutely. And we're happy. Look, we look forward to the facts coming out.
Right. So I'll just take a couple minutes.
Sure.
And my assistant.
Hi.
So.
Oh, you're warm. I want to hang on to you.
So I was talking to Mary about what I'm trying to offer to clinics as a procurement service, and she said, you know all about this.
Oh, we have already a relationship with ABR.
Oh, okay.
So is that the sort of thing you're doing?
It's a startup, and I want to get in every state. That's my goal.
Yeah.
But I'm trying to connect with medical directors of either private, smaller clinics.
Yeah.
Obviously, a higher volume would be good for the fetal tissue for researchers. So there's already a service there. I'm thinking with my business head that
using them for over 10 years, really a long time. So I just kind of renegotiated the contract. They're doing the I can't remember what they call it, but the big collection for government level collections and things like that. So I'm trying to think of other providers in our town.
So I don't want to sound like a salesman here, but I'm going to. So we return a portion of our fees to the clinics. So just as a way of thank you for this. Just trying to establish.
Get a toe
in
and make it sound.
Right.
All right. And just kind of renegotiate the contract.
We return a portion of our fees to the clinics.
Because of what we do and because we use fetal tissue, we don't want to. We want to be as politically correct as we can.
Right,
we
I know.
don't want a whole lot of people coming in and slap us because you're doing this and you're getting all these scientific people here and they're all agreeing, that kind of stuff.
Yeah,
so.
It's kind of counterintuitive, isn't it? Right, like normally, like embryonic stem cell research, like the big controversial, like whatever, and like.
And you know what the
compared
really
to
weird thing is? Embryonic. There's still a lot of controversy about that. But then fetal kind of got lost in the mix.
Was it ever controversial? I mean, I'm young, so I don't know.
It was never outlawed. Where during the Bush administration, Bush 1, it was no federal funding could go to stem cell research or to embryonic cell research. But fetal tissue was taken out of that. So we continued to send tissue to people like NIH. Even though the government was paying for it, fetal tissue weren't put in that little box of embryonic because it's different. Now they're trying to make abortion illegal, and that's where we get our tissue. Now they're trying to make abortion illegal, and that's where we get our tissue.
You probably know Jackie Barbic.
Yes.
Was it? And she mentioned to me that you guys, that I should talk to you if I wanted the fetal tissue.
Yes.
But I thought you only procured from her clinic. It's not.
No, we procure from her clinic on Saturday because that's the day they do large cases. Now they do induce fetal demise at about 21 weeks, depending on the doctor. Sometimes
because for BLT I'm wanting like 18 to 22 weeks.
Right. Yes.
Right.
And that would be fine. So if we had 18 or 19 weeks, then that we could get those to you.
Okay, and it doesn't have digoxin though.
No,
okay,
it does not.
Yeah.
And we always, we've been in the business long enough. I can tell if it's been ditched or not. I just look at it. I go,
oh, really?
Yeah. I mean, it has a smell. It's not right. So it's just kind of icky.
Yeah.
But we also have clinics in San Diego, in Oregon, in Minnesota, and we soon will be starting in New Jersey and Philadelphia.
Oh, wow.
Not at Dr. Gossel's clinic, though.
Right.
The whole point is not to have a live birth.
Okay.
And so the doctors have all, unless it's somebody who has had 6
pregnancies and 6 vaginal deliveries.
And then it just kind of
pregnant
pops
again.
out.
They put lambs in, and she comes in the next morning. And I literally have had women come in, and they'll go in the OR, and they're back out in 3 minutes. And I'm going, what's going on? Oh yeah, the fetus was already in the vaginal canal whenever we put her on stirrups. It just fell out. I'm going, what's going on? Oh yeah, the fetus was already in the vaginal canal whenever we put her on stirrups. It just fell out.
Wow.
So, you know, because if they've had a lot of births, then that's kind of what happens.
Right.
But most of the time it is not intact. We have some other people who would like to get like the biliary tree area, you know, that kind of thing. And I think over the past 3 months we've been able to send 2.
Really?
Because they just aren't. The abdomen is always ripped open.
Wow.
And I don't understand.
Are the organs inside intact, like the liver and the
organs are
reasonably?
Everything will just get ripped up. You know, whenever we have a smooth portion of liver, we think that's good because most of the time it's like, you know, just the instruments they go in to pull, and it's just whatever presents first. And unfortunately, and I don't know why, a lot of times the abdomen presents first, and they just go in and start pulling. And
so they just pull it out by the abdomen.
They're not trying to.
They're not trying to. They don't have my interests in mind.
Or mine. It really pisses me off. Whenever we have a smooth portion of liver, we think that's good.
Well, see, this is the thing, quite honestly. I used to go into this argument. So Linda ABR is a not-for-profit and wasn't paying any of the clinics and was funding places in Hawaii for themselves.
Oh my gosh.
And all sorts of things. But I would go into clinics and they would say, oh, you're a for-profit and you want to pay us? But like, and I'm like, so I want to pay you. She doesn't want to.
And she has a place in Hawaii.
And I'm like,
oh my God.
We're trying to give money to you. You know, and they would say, yeah, that is kind of strange, you know? And I said, right, and I pay tax, just to be clear, that actually donates, ends up funding programs back to you guys. So no tax, no payment, tax and payment.
Yeah.
You know, it was like that. And they'd be like, okay, that makes sense, right?
We're usually standing right outside the door where they're doing the procedure in the OR, and we're in the lab area. And that's kind of
Gotcha. Yeah.
And so we're just kind of standing around waiting, and then we get the tissue. The doctor makes sure that the termination is complete, and then we have it immediately after. So
like immediately after, they just bring it straight over.
They just bring it out. The doctor kind of goes, and then they usually say it's done, and so.
Some of some staff, not that I know so much on the Planned Parenthood side, but I wouldn't be surprised. There are some staff in the past that have been on the payroll with ABR. I mean, like there's like well enough known.
Oh, wait a minute, I didn't follow that. So,
like a nursing director or somebody who's literally like a paid employee, but they're like a paid.
Are they doing procurement, or they're just sitting there holding the fort down?
Like an advisory role. But they're tied enough to.
Yeah, I don't have someone. Yeah, you can go ahead and.
From like an advisory role. But for a long time there were some clinics that, because they had paid advisors that were sitting on boards for these clinics, they were also an advisor to ABR.
Okay.
You were just never going to go anywhere with it. You know what I mean?
So I think the American people know who Planned Parenthood is, and that we are not selling body parts.
A company like this that wants to give our organization money for the tissue, like, I think that's a valid exchange, and that's okay.
We have independent colleagues who generate a fair amount of income doing this.
They want cardiac, or they want eyes, or they want neural. Certainly everything we put, gonads. Oh my God, gonads.
Sorry to interrupt, Dr. Westhoff, but Dr. Nicotola has mentioned your name before as a good conversation. You
just met my procurement technician. We work with, we do fetal tissue collections and other human biospecimen collection. Yeah. So I don't know, Deborah's kind of been our contact on the national level for the past 8 months or so.
Yeah, we haven't been working with anybody who wants stem cells. We've just been working with people who want particular tissues. Like they want cardiac, or they want eyes, or they want neural, they want spinal cords. So, I mean, that sort of thing. Certainly everything gonads. Oh my God. Gonads. Everything we provide is fresh. We have a department that is focused on our abortion providers, and the head of that department is here, and I'm sure they have, in essence at their fingertips, information about volume and second try versus first try and so on. And I think they would be the right people to explore whether affiliates are different. Obviously, we would have the potential for a huge PR issue on doing this.
It's something we're very discreet about it. Everybody else is very discreet. Yeah.
Well, I will make sure you're here for the whole
week. We'll be here all weekend, as they say. We've got to.
So but it's Deb Nugatola you've spoken with so far. I'll make sure you talk to a couple of our National Office Abortion people.
This is important. This could destroy your company and us if we don't time, those conversations correctly.
This is Deb Vanderheide.
Hello. Good to meet you.
Pleasure, thank you. Is it the liver only that you're
Oh no, it's all kinds of stuff. Definitely, liver is probably easily the most, the highest in demand right now. And then neural tissue and neural progenitors is another big one that's very difficult, because that's where specimen quality and the antagonism of specimen is a big concern, because the brain is really, really fragile. So.
Yeah. Do you, can I ask you about remuneration?
Yeah, conversation,
what's your policy and what have you been?
We would, however they want to work it is fine with us. Typically, most places are doing per specimen, because it just makes most sense, because that's how they work and that's how we work as well. That's actually, I'm supposed to have a discussion with one of the affiliates possibly later this weekend about that.
One of the things that we advise is our affiliates is to really consider that carefully. That might be a different situation with independents, though. I have been talking to the executive director of the National Abortion Federation. We're trying to figure this out as an industry about how we're going to manage remuneration. Because the headlines would be disaster.
It has to be very discreet, absolutely. What I understand from Deborah is there's not a set PPFA national policy right now, or how does it all come together?
We're absent a policy, and that's relatively intentional, and the policy that we do have suggests that you just really think about what you're doing, vet your procurement service, and if there's any way you can do it mission-based, that's probably better. But if you do decide that you want to engage in remuneration, you just really need to think that through and think New York Times headline when you're creating your policy.
You don't by any chance have on you the PPFA guidelines on tissue procurement or anything like that?
There are no guidelines.
Not written.
Yeah, there are guidelines on research, but there are not guidelines on tissue procurement.
Okay.
And there will never be guidelines.
Oh, just to keep it.
There's no guidelines. If something qualifies as research, if a affiliate wants to participate in a particular research study, there are guidelines that how that happens. If they're gonna, participate in something like this, there are mechanisms by which contracts can be reviewed and things like that, but there are no guidelines.
Deb gets requests, and I get requests about whether or not people should be working with. Well, the requests have been coming. We hear STEM Express.
STEM Express is the other one,
and should we work with them? Because Shasta Pacific, now Northern California, they work with them, and they're sort of vocal about it.
Yeah, STEM Express has the whole north,
For the first few years that it happened, it was treated as research, and then we realized that was kind of overkill.
Yeah.
Because we didn't have a particular IRB-approved study.
Right.
It just didn't fit into our framework, and so we just kind of backed off of that.
I guess I'm talking even in terms of like compensation and stuff like that, just to.
Nothing is written.
Yeah.
There's nothing at stake.
If they do it, that's fine. We're not going to say no, but we want them to think about really the New York Times headline.
Yeah. To go into.
This is so bad. This is really worth getting. I don't even know what a specimen generally
Right.
brings
Yeah.
in.
Yeah. It really varies from place to place. We would start at probably $100 per specimen is what we've been quoting people, and that can, some people do more, some people do less, and it just kind of depends.
We have independent colleagues who generate a fair amount of income doing this, and if they have a smaller
At the
margin
independent
or don't
clinics,
have
yeah.
the ability to fundraise because they're not a nonprofit, that's really helpful. Well, it's an issue you might imagine that we're not that comfortable talking about on email.
Oh.
And so we want to have the conversation in person.
Yeah.
Folks will ask the national office questions, and we certainly have answers to the questions, but we don't have a policy per se. And that is by choice.
Yeah.
So for now, that's the way it will be.
Well, yeah, but we're doing it, there's opportunities for people to find out about it.
I sort of, my stance on that is like, I feel like we're sometimes bullied by ridiculous lies and this media that doesn't focus on truth. And I don't really think that we should participate in that level of discussion, and that we should operate as an organization the way any other organization would. And so I don't feel that I'm a researcher at heart, so like I love the idea of being able to do this and participate in research. This is my I would love to see this happen somehow. I'm probably maybe not so sensitive to like ridiculous type. Like, let's have a debate on the real issue and truths. That's a discussion I would participate in. I don't feel like we should participate in discussions based on color. I mean, that's kind of my thought process in that.
Based on what?
I may be alone, but that's what I feel about that.
Are you suggesting that the conversation was too conservative?
I feel like sometimes like this is my first time here. I've only been with the organization for a year and a half, so I don't know the history like somebody who's been here for a really long time. But I've always been a supporter. I've been a patient, and now I'm working here, and I just feel like we shouldn't participate in ridiculous social discussions. We should participate in the valid, and that we should not curtail our business for ridiculousness. Maybe curtail our business for an actual real discussion.
I don't think anybody was suggesting that curtail. The message to me that I heard today was go for it. We think it's a great idea. Just do it right.
Exactly, and I understand that, but like a company like this that wants to give our organization money for the tissue, like I think that's a valid exchange, and that's okay, providing that we are very sensitive to the patient and consent and all of that. And I don't see a problem with that. I understand that we have to worry about a rep and everything like that, but.
Well, I think a congressional hearing scared the bejesus out of people 15 years ago when there was a congressional hearing on it. It turned out to be fraud. But
what was the fraud?
There was a person in opposition that said Planned Parenthood had changed the way it does its procedures so that they can collect tissue so that they can sell tissue. It turned out that was false.
We've been very good at getting heart, lung, liver, because we know that. So I'm not going to crush that part. I'm going to basically crush below, I'm going to crush above, and I'm going to see if I can get it intact.
But it sparked a congressional hearing and some federal legislation, which is where some of that came from. So we just want to not have to repeat that.
Right.
And there are a lot of Planned Parenthoods that participate in donation programs that are reimbursed for. And
that's fine.
Yeah, it's fine. We're just suggesting that call us, help us, or let us help you walk through some of those steps to make sure
Can I give you my card?
Yeah.
We can talk about this some more.
So yeah, I think go for it and use us to the extent that you can.
Okay. All right. Thank you very much.
Yeah.
Appreciate it.
And I know Northern California, Marmonte, LA, they all provide donations for the unit. So they would also be the people to check with.
All right, thank you so much.
Yeah, she asked more questions than anybody.
Oh, she was really getting into it during the...
Yeah. I hope that she didn't leave thinking that we were saying don't
We're
do
discouraging it.
Because Roger said I'm going to say a number of things, and I only want you to go away with one message. I think this is a good idea. Right. Now, here's what you need to look out for, and then at the end of it, he said, and I just want to reiterate, I think this is a good idea.
State health investigators have served subpoenas for records at several Planned Parenthood offices in Texas.
Texas does have hard evidence showing Medicaid fraud as well as violations of federal and state law concerning abortion procedures.
It was trunk intact. So usually what I do is if it's a breech presentation, I'll remove the extremities first, the lower extremities, and then go for the spine and sort of break it down that way.
Those are actually, the people in those videos are amazing and compassionate and wonderful doctors and staff of Planned Parenthood.
I always try and keep the trunk intact, just by function of always trying to aim for the spine and bring it down.
If there was a training, I would just basically say any research case I'm going to do. And as you get better, I'll let you do more of those cases, but we really need to try to do this intact. So.
Well, this will give me something to strive for.
Excuse me, are you all with Planned Parenthood in Texas? Did I hear that correctly?
I'm with Planned Parenthood in Texas. She's with Whole Woman's Health.
Oh, with Whole Woman's Health.
Yes,
Okay, gotcha. So my name is Robert Sarkis. I'm with a company called Biomax.
Hi.
We do fetal tissue procurement, like for stem cell researchers and things like that. Cool. And we've been in contact with Dr. Nicotola the past couple of months, just talking about which affiliates would be good to partner with and all that. And she actually mentioned both of your organizations simply because the volume in Texas is like at these few clinics that remain are skyrocketing right now. Is your medical director here?
He
at
is
this
here,
meeting?
yes, and I'm going to be seeing him this afternoon, so I can send him over to the...
Yeah, let me go ahead and give you some of our stuff. Yeah, and we do return a portion of our researcher fees to the clinics that work with us. So
just so it's worthwhile for everybody.
I think that ABR is doing $50 per specimen right now, was what I last heard. We could do 60. Not that we have to fight over it. I mean, if there's room for us to come in on the next day, like we're happy to do that too.
Yeah, I'm sure there won't be, a problem with volume. Given, the unfortunate situation the state's in. But
what is your clinic volume like now? How many procedures per week?
Well, I mean, it's changing now because the law went into effect last week, where like the rest of the clinics in the state closed.
Right,
and there's
that's
just
what I
8 that are open.
Right.
So it's hard to predict what it's going to be, but I know that 80,000 abortions happen in the state, and so we have divide that by 8.
So I guess I'm just
we're scheduling 25 procedures a day, 3 days, 10 days a month.
Wow.
Is when we do procedures. And we were scheduling 25, and now we're going to be increasing it to 30. I'm the only provider, so there's only so much.
Oh, you are one of the providers. Oh, I didn't realize.
Yeah,
I didn't see the
No, that's okay. I'm the provider at our Austin clinic.
Okay.
So but we're right now we don't know what's going to happen.
How far do you go at the Austin clinic?
21.6.
21.6. And do you DIG?
I use DIG after 20.
After 20.
Yes.
Okay.
So you guys can't take DIG stuff?
Right, yeah, DIG nukes the stem cells, so it's just no longer useful. We also, we're typically looking for later gestations, because that just happens to be like the sweet spot with how the cells differentiate and everything.
Okay.
And
I think that's hard. Well, we go to 22 because of, the band, so we can go further, but definitely DIG.
Right, yeah, and they need to be pretty intact as well, like mainly the body cavity, not too torn up. Like we don't want to be playing like find the liver. Oh, it's in 8 pieces.
Right. Okay. So I mean, I do 2 days cervical prep.
Oh, good.
So
it's
not like I'm doing the same same-day cervical prep, so I can usually get good dilation. So my aim is usually to get the specimens out.
Like an induction type of thing?
Well, no, I do laminaria.
Yeah.
But leaving him in for 24 hours, I can usually get 3 to 4 centimeters of dilation, which usually allows me to get to extract it more intact. I do that starting at 18 weeks.
Yeah.
The 16 to 18 weeks, I do a same-day prep, and so that's just sort of that.
Yeah.
Sort of.
Do you use ultrasound guidance for that? Yeah.
Yeah.
So can you convert to breech?
I can if I need to, and if it's I generally don't have to do that I don't usually do it in the 16 to 18 weeks because I don't really need to.
It's just not necessary.
With a further gestation, I will sometimes do that if it's a cephalic presentation, just because it's easier to get. So
Because that's what Deb was telling us really makes a difference for tissue collection at PPLA. Yeah, is that if you convert to she said if you convert to breech, she says then you get she said you get increasing dilation as the case goes on, and then she says at the very end she's like you can even evacuate the entire calvarium intact if you need to, which you do if there's a request for fetal brain. They're always wanting both hemispheres, and so
I haven't been able to do that yet.
To get the calvarium
intact.
It's like maybe next time.
I know, right? Well, this will give me something to strive for.
Exactly.
Excellent. Ultrasound guidance, they can just change the presentation.
To bring the body cavity out, intact and all that.
So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate the intact calvarium at the end.
And so, of those two 20-week cases last week, for example, what was the intactness of the specimen like?
It was trunk intact.
Trunk intact.
So usually, what I do is, if it's a breech presentation, I'll remove the extremities first, the lower extremities, and then go for the spine and sort of bring it down that way.
Right. You said if that's a breech presentation, or if that's a
if it's a breech presentation, and if it's cephalic, I'll try and get the cal first. But if I'm struggling getting the cal, and usually it's a function of how good my dilation is. Oftentimes it's hard to get around the cal, especially the 20-weekers are a lot harder versus the 18-weekers, and so at that point I'll switch to breech.
Good. Yeah, I was just curious what we might be working with.
I always try and keep the trunk intact, just by function of always trying to aim for the spine to bring it down.
Oh, interesting. So that's what you can grasp is the spine.
Exactly. And so you keep it all in alignment, and it just makes the procedure easier. Every once in a while, if the dilation's bad, then I do whatever I can.
Yeah, he's got to change your game.
And that's like a function of the individual patient characteristics.
Right. Liver is in huge demand right now.
Is it really?
Yeah,
okay.
Liver. There has been an uptick recently in requests for heart valves.
Okay.
So intact hearts, intact livers.
One of our POC persons is really into organ development, so she'll she'll pull out like kidneys and the heart at the heart we frequently see at 9 weeks, and she always looks for it, and so she's
just
always
for fun.
Because it's amazing. It's just it's sort of I have so much respect for development. It's just so incredible how but she's always at 10, 11, 12 weeks she's like trying to find the kidneys and finding all the organs and manifestation layers.
Yeah. Have you guys provided any specimens for research ever? Or
no, I don't know if it's ever happened. So I've been with them just for a little over a year.
Okay.
So in Texas, and so I don't know what they did before.
Because I've been told that Gulf Coast does provide specimens, and just out of their own research department. Apparently, it's something that they do. Yeah. But I mean, if they're like we said, we try to do everything for you in that within that space. So if they're kind of sick of it, we'd be happy.
Definitely. Well, I think I'll talk to Daryl.
Yeah, please do.
But also have him
yeah, send them by. We'll be here all day and all day tomorrow. So. Definitely. Yeah, it was very good to meet both of you. Thanks for
Thank you.
Good
to meet you. Yeah, I'm sure we'll be in touch.
All right, definitely. Thank you.
See you, ladies.
Yeah,